human body. We looked at that in the last episode. It pumps blood throughout the body to nourish every cell. The heart weighs between 250 to 350 grams and is a little larger than the size of your fist. So if you clench your fist, your heart is just a little larger than that clenched fist if there is no enlargement of your heart. All right. Your heart is located between your lungs in the middle, but slightly to the left side of the chest. All right. It's very important that we know that the pumping of the heart is called the cardiac cycle and occurs about 72 times per minute. Each day, the average heart beats about 100,000 times. All right. And more often than not, it does that silently without you being aware of it. It doesn't, it doesn't make noise. All right. Except there's something wrong. So as you're listening to me today, I'm sure that you are aware that your heart is beating, but I mean, it's beating silently, it's doing its own work, and it's allowing you to listen without any problem. But if palpitation comes, like we looked at in the previous edition, or it's possible that one will be like, what's going on here? But the heart doesn't usually do that. It goes on beating without any, strain or stress to you if it's kept healthy. All right. A healthy heart makes a healthy life, and a sickly heart makes a sickly life. No wonder the Bible tells us that keep thy heart with all diligence, for out of it are the issues of life. And I did mention the other time that the heart is one of the most important organ in the body. And by the virtue of my training, and of course, the bias that I hold, I would say the heart is actually the most important organ in the body. You know why? I mentioned it during the last, time. I'm going to mention it again for those joining us for the first time today. Number one, your heart is the first organ that starts work, all right, in the human body. And it starts work even before the woman gets to know that she's pregnant. All right. The heart starts beating about 22nd to 23rd day of pregnancy before the woman gets to know that she's pregnant. Ordinarily, a woman will get to know that she's pregnant after she would have missed that period, and that will take like 28 days averagely. And the woman will not just rush to check and do pregnancy test on the 28th day. If she will wait for 2 3 days and say, this thing is not coming. What's going on? This thing is not coming. And then goes to check and then find out. Some people will discover after a month, after a week of not having seen their period, and they say, let me check what's going on and everything. Their heart would have started beating before the woman gets to know about the fact that she's pregnant. That is how important your heart is. And it goes on through life, okay, until the person signs out. The last organ to sign out before you can certify anybody dead is the heart. If the heart is still beating, even if the person is unconscious, you cannot certify that person dead. If the heart is still beating, even if the person is not breathing on his own, if he's connected to a ventilator and is being assisted to breathe, you cannot say the person is dead. If the brain is dead, somebody can be brain dead without being, biologically dead. All right. Until the heart stops beating, you cannot certify anyone dead. That tells you how important the heart is. Is the first organ to sign in, is the first organ to start working, is the last organ to sign out. I mean, that is a very, very, important organ. And you know what? We've got to keep it. We've got to care for it just as it's caring for us. A healthy heart makes a healthy life, and a sickly heart makes a sickly life. All right. Heart diseases are responsible for 18.6 million deaths every year around the world. So says the World Health Federation. And it's even on the increase. That tells us something that we've got to take care of our heart. Your heart needs you. Okay. Now, not just that, 80% of causes of cardiovascular disease are preventable by cultivating healthy lifestyle behaviors. Now, if 80% are within our control because they are preventable, then we should, I mean, this is a good news for me. It means that we can, to a very large extent, prevent, cardiovascular disease. We can, to a very large extent, deal with this thing and make sure that, we stem the tide. It does not keep ravaging and, killing people. All right. Cardiovascular death is the most common, death globally. But we can do something about it because 80% of the causes of cardiovascular disease are preventable by cultivating healthy lifestyle behaviors. Those are the things we want to stress today so that we can lead a very healthy life. We can give our heart the best care that it needs so that everything can go well. You know what? Your heart needs you. We cannot stress it enough. Therefore, take care of your heart. Just as the heart is taking care of you, beating, so faithfully, as we are listening, it's beating and it is not making noise. We need to make sure that we take care of our heart. Take care of your heart. You have a responsibility to that heart to take care of it, to give it the right things that will make it to develop properly, that will make it to function well, to give it the right thing, to expose it to the right, environment that will help its functions. Take care of your heart. It's very, very important. And you know what? Lifestyle modification is key. We've got to embark on this. Lifestyle modification is key. Number one, reduction of salt intake. We've got to reduce our salt intake. All right. As you grow older, okay, your desire for salt should reduce. All right. So reduce your salt intake. We're not saying don't take at all. We're saying reduce it. Low salt, not no salt. All right. And of course, sometimes people talk of, soda water. Let me take soda water, and I don't want Coke. Give me soda water. It's still, a part of it is it has sodium in it as well. All right. So we need to reduce our salt intake. All right. Reduce consumption of processed meat. It's important that we know this. We've talked about this before, but we just need to stress it again. This is one of the ways to take care of your heart. Consumption of processed meat, red meat, and the rest. These things, we're not saying don't take at all. We're saying reduce. All right. So that you don't expose your heart to the things that will, harm it. All right. Reduce intake of fat and cholesterol rich food. Okay. It's important for us to know fried things, fast food, things that are laden with, saturated fats. We've looked at that before. You can go through the previous episodes we've had. When we're talking about tips to a healthy life, to a healthy heart. All right, we broke it down: fats, saturated fats, and unsaturated fats. You can go through. We'll post the uh, those that recording to us again so that we can go through and be able to equip yourself with the knowledge. All right, so reduce all those. Smoking cessation. You've got to, if you smoke, and smoking is not just all about being the one smoking. There's also what we call secondary smoking. All right. Those are people who hang out with those who smoke. And as the person is smoking and puffing it out, you're busy taking it in. That's secondary smoking. Is as dangerous as primary smoking. Is even much more dangerous. That's what health experts are telling us that secondary smoking, has the same risk, and in some cases even higher risk than primary smokers, all right, in causing illnesses, causing diseases, heart attack, cancers, kidney disease, stroke, and so many others. So it is important that smoking, cessation should be praised and should be encouraged. All right. And of course, exercise regularly. It is important. When you exercise, you're giving your heart the opportunity to make use of itself, to be excited, so to speak. Make your heart excited in some ways. All right. When you're excited, you're happy. Let your heart be excited as well. All right. Exercise regularly. Very important. So let's quickly deal with this. Eat less salt. It's important that you take note of this. Eat less salt. And this can be cultivated. And it's very good to say that we should even expose our children to this. I mean, in this world of noodles, and everybody wants to just, it's fast track stuff. All right. People get the noodles and they do one to one. They sauce one sauce to one pack of noodle. It's not, it's not good. It's too salty. I mean, you can make 4 packs of noodles with one sauce and you will still feel the salt. So I wonder how people do one for one. It is too salty. All right. And it's not going to help anyone. And, you know, our children take this. We need to cut it down for them. Let them know that too much salt is not good for the body. So eat less salt. Not no salt, but low salt. And when we talk of salt, we're also talking about, you know, salty condiments. So, I mean, I once had a patient who said, "Oh, doctor, I don't use salt again. I don't take salt at all. What I do now is to put plenty Maggi. It is still salt." All right. Cut down on it as well. We're not saying don't take salt. We're not saying don't put condiments. We're saying reduce it so that, the damaging effect of excess salt can be dealt with. Is very, very important. So excessive salt intake can predispose and does predispose to high blood pressure and cardiovascular diseases, can predispose to renal dysfunction and kidney stones, can predispose to bone mineral density reduction and cause, some bone diseases. Of course, can predispose to obesity. The food that is well garnished with lots of salt, you want to take more and eat more and eat more and eat more. And even without that, there is a link between, salt intake and, increased body mass index, increased body mass, which will lead to obesity. So that happens. It can predispose to cerebrovascular disease, that's stroke, and cognitive impairment. These are things that excessive salt can do. Again, we're not saying don't take salt. We're not saying don't put salt in your food. We're saying reduce it. Eat less salt. Very important. Dietary salt intake reduction, okay, will help us in reducing the risk of developing hypertension. For those who are not hypertensive, if you eat less salt, the risk of developing hypertension will be reduced. It will delay or prevent the incidence of antihypertensive therapy. For those who may be having what we call pre-hypertension or high normal, okay, or uh, the current classification talks about elevated blood pressure. All right, those who are very getting close to you, or those who have family history of hypertension, by reducing your salt intake, the chances of developing hypertension will be reduced. And if you find out that sometimes your blood pressure shoots up, maybe during anxiety, when you're anxious and things like that, by reducing salt alone can reduce your blood pressure by up to 20 over 10 millimeter mercury, and that can delay the commencement of antihypertensive therapy. It can facilitate blood pressure reduction in hypertensive patients receiving medical therapy. I just mentioned it, that reducing salt intake alone can reduce the blood pressure by 20 over 10 millimeter per mercury. Okay, and may represent a simple cost-saving mediator to reduce cardiovascular morbidity and mortality. I mean, if you reduce less, if you eat less salt, that means you're going to purchase less. That means that you're going to reduce, cost of buying salt, and of course, cost of complications as well. This is, cost effective. All right. Increase your fruits intake, increase vegetables and whole grains and nuts. The slide I showed before, talking about eat less salt, we're talking about what you need to reduce. Reduce salt, reduce intake of processed meat, reduce intake of cholesterol rich meal, and the rest. Cease smoking. All right, but this is talking about the things that you should increase. Increase the intake of fruits, vegetables, and whole grains and nuts. All right, all forms of fruits are good. The fruits are good, vegetables good. All right, very important, and they are very they're not as expensive as we think. And I mean, a bottle of soda is going for as much as 3, 4, 500 now. With that same amount, you can buy banana. With that same amount, you can buy oranges. You can buy, watermelon. You can buy pineapple. You can buy beetroot. You can buy garden egg. You can buy cucumber, carrots, and co. So increase your intake of fruits and vegetables. Limit intake of sweet drinks, sweetened sodas and co. Take healthy beverages. Okay, that cocoa drink is good, is an healthy beverage, is a healthy beverage. All right, green tea is good. Hibiscus tea, chamomile tea, pomegranate tea, and so many others like that. They are good. All right, you can take more of those and cut down on the fizzy drinks. All right, of course, we know that fizzy drinks can lead to weight gain. So reduce those ones, and invest in healthy drinks. All right, dark chocolate is good for your heart. All right, the dark chocolates are, you will see in standard, supermarkets, you'll see 80% cocoa, 100% dark chocolate. Those are good for the white chocolate. Well, if you want to just, enjoy yourself, indulge yourself a little, no problem. But those ones have been really, diluted with saturated fats and the rest. But dark chocolate, very good. And then aim for a healthy weight. A healthy weight, your weight and your height. All right. So a healthy weight, how do you know a healthy weight? The BMI, body mass index. All right. Weight divided by height squared will give you your body mass index. So weight divided by height divided by height. So if your weight is, let's say your weight is 80 kg and your height is 1.65 kg, I mean 1.65 meters rather, the body mass index will be 80 divided by 1.65 divided by 1.65. The normal body mass index is between 20 and 24.9. When it's 25, is already overweight. The person is overweight. So 25 to 29.9 is overweight. 30 and above is obesity. So you can just do that simple thing tonight after we finish this session. Check your weight, check your height in meters. Your weight divided by your height divided by your height. So that's weight divided by height squared. Again, if your weight is 80, 80 divided by 1.65 divided by 1.65. That would give you your body mass index. If your body mass index is 25 and above, your weight is not ideal for your height. You need to lose some weight. All right, that is going to help. Okay, so we want to emphasize on the fact that, take more fruits and vegetables, because a lot of the things we eat impact on our health. All right, so invest more, take more fruits and vegetables, whole grains and food. Okay, a healthy source of protein, fish and seafood, legumes, liquid plant oils. We've talked about soybeans oil, canola oil, and the rest. These are things that you can take. All right, and then let's minimize the intake of beverages and fruits with added sugars, fizzy drinks, ultra processed food, processed meat, food high in salt, and alcoholic beverages. We need to limit them. It's very important that we do this, okay, so that we can tilt the pendulum towards, our own advantage. It's extremely important that we do this. We've got to take responsibility for our heart health, and ultimately for our health, really. And as we take responsibility, I'm sure that, we will enjoy it. We will be the better for it. You are what you eat. You are what you eat. All right. The processed meal, the fast food, the all sorts things that are very, very rich in calories, all right, filled with saturated fats and the rest, will only increase the body mass index of the person, make the person obese, and reduce the quality of life of the person. One of these days, we're going to look at obesity and your heart. All right. Meanwhile, we're not saying don't take any of this. We're saying cut it down as much as possible. Invest more in things that will help. Plant meals, fruits, vegetables, take, water often, reduce the intake of fizzy drinks and the rest, and of course, exercise. These are things that will help us. They will help us, and we need to invest in this. You may need to change your diet a little bit, all right? And I'm sure that if you do, you will see the benefits. The energy will come back, the enthusiasm will come back, the alertness will also increase. Very important for us to know. Also, regular physical activities. We need to exercise, get your body moving. Regular physical activity, it will help us a lot. It will help us to reduce the risk of developing heart attack, the risk of stroke, the risk of diabetes, the risk of hypertension will reduce. It will cut down the prevalence of overweight and obesity. All right. Very important that we know that exercise will do all of this for us. Now, some people have this erroneous belief. My weight is ideal. I don't need to exercise. No, exercising does not have to do with losing weight alone. In fact, you can exercise and still maintain adequate weight. Very, very important. It improves mental health. It improves quality of life. It will improve, cognitive, processes. It improves, memory. All right. Exercise is extremely good for everybody. Everybody. And please get engaged in it. Increase your physical activity. Very important. It reduces dementia by up to 30%, reduces all-cause mortality by 30%, increase physical activity, reduces cardiovascular disease by 35%, diabetes by 40%, colon cancer by 30%, breast cancer by 20%, reduces depression by 30%, reduces risk of fracture by 68%. It's important that we know that exercise does not have to do with, weight reduction alone. No, it has other benefits, and we've got to engage in it. And you know what? If you say, oh, I don't have time to exercise, But increase your physical activity. Start moving. So sit less and move more. Sit less and move more. That is what we advocate. Sit less, move more, keep fit. All right. And there are ways to go about it. So how can you increase your physical activity, your movement? Okay. Keep moving. Number one, when you're receiving calls, you can make up your mind that look, for every call I receive, I will walk. If when the call comes in, as I pick up my phone, instead of sitting or lying down to receive the call, I'm going to walk. By so doing, your step count will increase. You will be exerting yourself, so to speak. Very important. You may not have the time for the rigorous, you know, vigorous exercise, but you can move. Pick up the phone, you want to call somebody, make it a walking call. Walk instead of sitting. Some of us were on the phone for 20 minutes, for 30 minutes. Do you know that if you have engaged in walking all through that period, look at the benefit it would have added to your body, all right, to your health. Very important. All right. Now, you can also decide that, oh, there are times you meet friends on the road and we talk and talk and talk. You can decide to take a stroll, walk as you talk. Very, very important. We can do that. Okay. You can decide that while you're waiting for your meal to get cooked in the kitchen, more, more often than not, most people will sit down and be watching television or sit down reading or sit down, looking at social media and co. You can use that period to walk around. You can look at your phone while walking in your living room, in your your house, and wait for the food to be done, and engage in something that will profit your heart and profit your system. Move more. The average person sits about 10 to 12 hours per day, depending on the kind of work the person does. And you know what? Excessive sitting, sedentary lifestyle have been linked to hypertension, linked to all-cause mortality, increases the risk of diabetes, increases the risk of cancer, increases the risk of premature death. So we are busy. Yes, you get to work from, I mean, you can imagine somebody getting to work from 8 to 4. You are just by your desk, just, trying to sort things out. Take a break after 2 hours. Get up, walk around after 3 hours. Get up, walk around, walk for 10, 15 minutes. Just walk around. Instead of taking the elevator, take the staircase. Walk. Do something. Move more. And walk as you walk. All right. While you're walking, while trying to answer, maybe you are in a meeting, a Zoom meeting, and it doesn't compel you. That meeting is not such that you have to be jotting down or typing things down, taking notes. You can walk and say, okay, this meeting, I'm going to be in my house, I'm going to be in the office, but I am going to use this period to exercise, to exert myself. All right. You can imagine if the Zoom meeting is for 1 hour and you use the 1 hour as you are listening, as you are walking, WORKING, you are also walking, WALKING. You can imagine how many steps you would have taken. So it's important that we devise ways to get moving. Very important. Every move counts. That's what WHO says, and it is very, very, very germane that every move counts. Okay, I mean, get up, do it, move, walk. All right, and perhaps these are some of the few things that have made cardiovascular disease to be on the rise in our generation. Sedentary lifestyle has increased. Before those days, if you want to change your television, you have to go to the television, turn it, you come back to sit. If you want to change the other channel, you turn it. But now your television is on your phone, is on your hand. You can sit. People sit for hours watching series. People sit for hours, surfing the net. People sit for hours, on social media, sit for hours doing meetings. Get up. If you go for board meeting, the people that organize the meeting, after 1.5 hours, 2 hours, let people get up and stretch their legs. It will help a big deal. Every move counts. Very, very. So exercise will increase, sleep quality, reduce blood pressure, increase the functions of your body within. All right. Reduce stress, reduce body weight. Very, very important. Reduces cardiovascular disease, reduces mortality. All right. And then take a break when necessary. All right. Try as much as possible to take a break when necessary. You've worked. You need to take a break. Very important. Deal with negative emotions. All right. Stress management is important. As much as possible, reduce stress. Okay. Reduce your exposure to stress. Try and deal with stress in a more professional way. If you need help, get professionals to help you to manage it. Stress management is important. Cultivate positive emotions. Be cheerful. Make room for humor. Make room for humor. All right? When you laugh, when you smile, when you are excited and you laugh, it releases beneficial hormones to your body. Those who engage in positive emotions, are cheerful, laugh, smile often, their risk of death is reduced, risk of hypertension reduced, risk of coming down with diabetes reduced, risk of premature aging reduces. And those who have negative emotions, always depressed, always frowning, always agitated and cold, increase their risk because stress hormones are released. And those things will cause, will impact negatively on their body. So please cultivate positive emotion. All right. You can give, yourself in a day. I mean, just create moments of excitement, moments to laugh. Okay. Put something that memories, things that have made you laugh before, you can replay it and watch it. All right. Get exposed to, uh, uh, responsible comedies. All right, that will make you to unwind and and be positive and laugh and cheer up. Very important. Reduce or stop alcohol, energy in drinks. Reduce it as well or stop. Okay, reduce exposure to pollutants as much as possible. Very, very important. These are things that will help our heart. Remember, the topic is your heart needs you. Part 2. You need your heart to be alive. Your heart needs you to function well. And these are things that your heart will thank you for if you can engage in them. Very important. And then know your numbers. Please, you are 30, you're 40, you're 50, you're 60. Check your blood pressures. Check your blood pressure regularly. It's important. I mean, someone rushed to, they rush someone to the emergency and, you know, unfortunately, the person has lost function of one side of the body, maybe the right hand and the right leg, and then blood pressure is checked. Is 200 over 110 or 120, and somehow the person, at least that has not been so devastating, the person is conscious and can talk and say, "Oh, Are you hypertensive? They said no. Used to check your blood pressure. The person says no, and they're like, "Ah, you don't check your blood pressure." Wow. We need to check our blood pressure. Don't give room to chance. Check, be active. Check your blood pressure, check your blood sugar, do your cholesterol, checks at least once a year, if possible, twice. Take ownership of your own health. Check, very important. Check your pulse rates. All right. There are people that say, oh, their problem is just typhoid and malaria, and they've never checked their blood pressure. They go to chemists, they will just write, go and take paracetamol, go and take this one. They do typhoid and malaria test for them. They say you have little typhoid, little malaria. No. For me, if somebody tells you that you have typhoid, you know what the person has said, has just simply said, your hygiene level is not up to par, because typhoid is a fecal oral disease. So if you're, and some patients are very, very, they are even proud about it. They say my problem, their only problem is typhoid and malaria. If they tell you that you have typhoid every month, check. They are telling you that you have not been circumspect with regards to your hygiene. Because typhoid does not is not in the air, it's fecal oral. It means that what you need to check what you're drinking, you need to check what you are eating. Somebody cannot tell me I have typhoid. I'm come. You've just abused me. That I'm not hygienic. So please, all this typhoid and malaria thing that people brandish around. Yes, malaria I can agree with, because we live in a malaria endemic area. All right. But I mean, even malaria you can control. So any little headache, typhoid and malaria. Toothache, typhoid and malaria. Leg pain, typhoid. Run away from such people. They just want you to do the test, get your money. Most of the time it's wrong, and they won't check the blood pressure. I once had a patient that was treated for typhoid and malaria for more than a year, 25-year-old young man then. This was, I mean, as far back as about 13, 14 years ago. By the time he presented to us, he was in heart failure. His kidney has packed up. We did more than 10 dialysis for him. He stayed in the hospital for more than a month. Eventually, we discharged him. All right. But unfortunately, about a month later, I saw the brother-in-law, fantastic guy. And I asked, how is this man? Will say, oh, thank you. You people really did well. You tried for us, this and that, blah, blah, blah. And I said, as they said, we lost him last week. I was devastated. And people have managed him for typhoid and malaria for so long. They never check the blood pressure. Please know your numbers. Very, very important. All right. These are also equally important. Keep your clinic visit regularly. Don't say they'll just say continue drugs, continue management, continue. They'll just write the same drug. No, there are few things that your doctor will ask you. There are things that you may need to clarify. At least it will let you know that, oh, you're in the right path. There was a patient that just went away. I mean, a colleague was telling me, just went away. They placed the patient on steroid. She just went away and never came back. By the time she came back the next, I mean, a year after, she had developed another disease. Steroid has, completely damaged her. And they now had to start, treating something else, because she just felt that, every time when I go, the doctor will just write the same drugs. No, please keep your clinic visits regularly. Take your drugs regularly. Very important. Regular annual health checks, also very important. Avoid self-medication as much as possible. Clarify health issues with your physician. All right. And if you don't have any, you can reach out. Try, and I mean, as we're aging, you should know that regular annual health checks, very, very important. And don't say I'm going to waste my money. No. One illness, it can be devastating. All right. And we're talking of quality of life now involved in this. All right. Take your medications regularly as prescribed. If possible, have a case that, that is well labeled, AM, PM, and you put your drugs for the week, and you can bring them out. That will help you, that will help to improve your adherence to therapy. Very, very important. Your heart health is important. Healthy food, very important. As much as possible, reduce stress. It may not be no stress, but reduce your exposure to stress and manage it well. Exercise, very important. Cardiology care, equally important. Please, let's do this, and our heart will thank us for it. We'll stop here for today. Thank you very much. God bless you. So we're going to give room for questions and answers. If you have questions, please raise your electronic hand so that you can be given the opportunity to ask your question. Meanwhile, please also help me unmute Dr. Donye so that, if he has one or two things to chip in, he can say. Please help me to unmute Dr. Donye. All right.
Good,
Thank you, Dr.
good evening,
Donye.
sir.
You can
Good evening,
contribute.
sir.
Yeah, good evening. Good evening, sir.
Good evening to the house. Um, just a summary of what we've been told today. Rest basically on what our responsibilities are to taking care of our heart, basically. And everything about the care of the heart is not about taking medications. There are a lot of things we can do or not do that will impact on our heart. And the summary of what we've heard today is doing exercise is good for the heart. Watching what we eat is good for the heart, and also checking our numbers. It's not until when it's said that we have a particular condition, it's good to check. So when we check prevention, they said it's better than cure. It might just be adjustment of lifestyle, basically, and we might not need to be on medication as it were. So the summary of what we've heard today is just about the little things we can do, which will go a very long way to keep the heart healthy and in a good shape. Thank you.
All right. Thank you very much. So please, if you have questions, raise your electronic hand so that you can be given the opportunity to ask your questions. And I want to recognize the presence of all the medical personnel, doctors around. Please celebrate you. You can raise your electronic hand if you want to contribute. Nurses, pharmacists, and all. If you want to contribute, please raise your electronic hand and you'll be given the opportunity. Yes, please go ahead. Yabo Oshodi. Thank you very much.
Good
You
evening,
have the
sir.
floor.
Well done,
Yeah, good evening, ma'am.
sir.
Yeah,
Good evening, sir.
yeah.
Please, I appreciate your talk, sir. And I just want to ask or to explain to me, because I did the echo, what did they put it to?
Echocardiography. Echocardiography.
Cardiography.
Go ahead. Yes,
Yes,
please.
I did the test some weeks ago or months ago.
Yeah.
So, and I wanted to have an eye operation. And I showed the
Okay.
doctor that we do the eye operation for me at Ancilla Hospital. When he saw that I have first degree left ventricular diastolic dysfunction,
Diastolic dysfunction. Yeah.
first grade or something like that. Let me
Grade
look for
one.
the result.
Grade one diastolic
Grade
dysfunction.
1. He said,
Right.
no, I should go and take a report from my doctor before they can do the eye surgery. I said, okay, that one. Then he saw the second one, something electrolytes, cardio, something too. That one said I have brandycardia. Those two
Bradycardia.
results that she saw, bradycardia.
Bradycardia. Yeah.
Bradycardia. So sinus bradycardia. So he
Sinus
said,
brad.
no, I should take a report that I can go for the operation. I'm 72 plus. So
Okay.
I now showed my doctor. That one said, this one is no problem. That is just eye something. But he now referred me to a cardiologist. which I will
All right.
see sometimes next week, 27th. But what I want is that explain to me, sir, that are this serious problem, because I used to have chest pain. That is why I requested for echo test, sir. So these two results now deprive me from doing my eye problem. So I want you
Well,
to
I
explain
think that
for that to me.
okay. Well, I think that the ophthalmologists have done the right thing. You're 72. He or she
Yes,
does not want to take chances.
yes, sir.
Grade one diastolic dysfunction can be as a result of so many things: hypertension, diabetes,
Yes, I have
obesity, even
hypertension.
aging.
I'm not.
So, in your own case, even if you are not hypertensive at 72,
I'm
you are likely to have.
hypertensive, but I'm not diabetic.
I know. I'm saying that even if you are not hypertensive, grade one
Yes,
diastolic
sir.
dysfunction is not unexpected at
Yes,
this
sir.
age. All right.
Okay.
But I
Okay,
mean,
sir.
we know that other things can cause it. You said you are hypertensive, so the hypertension could have
Yes.
also contributed to it. So
Yes.
I mean, it's just okay that the ophthalmologist says, you know what, let's
Yes,
a
sir.
cardiologist, I mean, certify
Confirm
that your
that I
heart
can.
is okay to go through this. All right.
Mm.
If he or she knew better, I'm sure your cardiologist is going to tell you. I mean, if there's no other thing looking around, it's going to tell you, you know
Yes,
what,
sir.
don't worry, mama, you can go for this. I mean, if the cardiac, if the ejection fraction is okay, which I
Yes,
mean,
sir.
you have not mentioned that anything is wrong with it. If your ejection fraction is okay, and there's no other major thing, if what they saw was just the grade one diastolic dysfunction, I mean,
Yes. After
the
all
surgery will be
the
done.
comments, so that is the conclusion.
I know,
All
I
the
know,
comments
I
they
know.
say normal, 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 normal,
No, no,
but
don't
that was the
worry. Don't.
conclusion.
I understand. So grade one diastolic dysfunction is the major thing they found. It shouldn't
Yes, sir.
stop you from going through your surgery. But the doctor, I mean, with regards to doing the right thing, I think he's done the
Yes,
right
sir.
thing. Right?
All
Because if
right, sir.
anything happens, I mean, and then your the sinus bradycardia,
Yes, sir.
the the cardiologist that you're going to see, I'm sure, will be able to decipher where it's coming from. If you're on some drugs,
All
there are
right.
some drugs that can reduce heart rates. All right, it will check, he or she will check your drugs and see whether you're on any
Okay.
of those drugs. Aging can
Drugs.
also cause a bit of reduced, I mean, heartbeats. Okay,
Okay.
there's what we call, sinus node dysfunction and things like that. All right, and then there are some other things, thyroid, I mean, if there's hypothyroidism. So I'm sure that your cardiologist will do a good job. So I
All
think
right,
you
sir.
should
Thank
worry.
you so much,
Yeah,
sir.
you're welcome. Okay, Ojomo, please help me on mute. Ojomo. Host, kindly give Bumi Ojomo the opportunity to speak. Please unmute your mic and then you can speak.
Good evening, and thank you so much for this lecture. It's very enlightening.
Thank
I just want to ask. I understand very recently that ulcer can cause like chest pain, or you know something like that feels like heart pain, and I'm wondering, because I thought that was in my layman's view just about the stomach. So then how do you distinguish that from like you're having a heart attack? How does the pain differ if you're having like chest pain due to ulcer? Thank you.
you.
If I'm clear.
All right. Okay, thank you, ma'am. Dr. Boy, you want to help?
Okay, sir. So
Yeah.
basically, for pain that will arise from ulcer. So there are, maybe I should start by saying there are things that we actually look out for when you complain about chest pain. Okay, and the most scary of them is chest pain originating from the heart, as it were. However, apart from the heart, there are also organs in the stomach area which can also give a semblance of pain, which can be similar, as it were, to a heart pain. So one of them is the stomach, as it were. And then if there's an ulcer, it could actually behave like someone has an heart attack. And then there's also what is called the pancreas, which is responsible for production of insulin, amongst other organs there. So basically, for this ulcer in question, for those who have ulcer, they will feel pain, okay? and the pain could actually be around, could be felt in the central part of the chest or the junction where the chest and the stomach meet. So there could be pain felt around that area. And the peculiar thing about the pain is that it tends to be peppery in nature or could be burning in nature. So it could be a peppery pain or it could be a burning pain. And in some group of people, after eating some certain food, they tend to feel that kind of pain. Or for some other group of people with hunger, they tend to feel that kind of pain. And another thing about the pain also is that the pain could radiate. By radiating, I mean it could spread from the front part of the body, as it were, okay, around the stomach area. It could actually spread to the back, almost at the same region around the back, usually. So when we put all of these things together, it could actually help us to say for sure if the pain is from the stomach and not from the heart. However, to actually make sure we're 100% sure, it's good to do a few heart investigations. Like the first person asked a question earlier talked about electrocardiogram. So there are like buttons to put on the chest to see the way the heart works and to know if there's anything that would suggest pain, as it were, with the use of those tests to know if the pain is from the heart or from other part of the body, basically. So usually for pain with the heart, it will occur with exertion. When you do something stressful, you will feel that pain, and it could come along with palpitation, to start sweating profusely, amongst other things that could happen. So I don't know if this little explanation will suffice to help us differentiate between pain arising from ulcer and then pain from the heart as it were. Thank you.
Okay, thank you, Dr. Odaye. Um, really appreciate it. I'm sure that clarifies your curiosity, ma. Um, Basically, those are the differences. All right. Um, very, very apt. So, any other question, comments? This is 3 minutes after 8, so we should be rounding up now. It's an hour with the cardiologist. If you have questions, comments, things you want to clarify. Okay, I think somebody just put a question on the um, okay, what are basic precautions in hypertensive with heart enlargement and diabetic with pacemaker? So I guess that is the question. Well, precautions are what we just discussed. So maybe you will after the end when we put the recorded version, you can go through it again, all right, and you can also listen to the part one. The This recording is also on YouTube. It's live on YouTube. So if you type an hour with a cardiologist, you will get the the YouTube version immediately. As we're speaking, you can also do that. I'm sure it will link you up with a live recording going on right now. So you can do that. That said, we will also send the Zoom meeting, the recorded version of the Zoom meeting on the WhatsApp platform. So if you're on the WhatsApp platform, you will get it later today. If you're not on the WhatsApp platform, you can, a number will be sent on the chat box. Just reach out to that number. Tell them to add you to the WhatsApp platform, and then you will be added. All right. Thank you very much. Um, Thank you very much for this thought-provoking session and lot of clarification. Okay, thank you very much, ma'am. Sir, how often will you hold the seminar? We're going to talk about it. What are causes of lightheadedness, particularly when one lies down to sleep at night, and what are the corrective measures? Dr. Daniel, do you want to quickly help us with
Yes,
this before we
yes, that's
round
all.
up here?
So I think it will be appropriate to at least see your doctor because if you're lying down and you're still feeling dizzy, we need to be sure whether it's from the heart or it's not heart related. It could be what we call vertigo, which in lying down you could still be feeling dizzy. So the typical dizziness is when you get out of bed or when you sit up, you tend to actually feel the dizziness. But when you're feeling dizzy while lying down in bed, there are other things to look out for. So seeing you in person will help to evaluate better. So I would advise you actually see a doctor. Thank you.
Yeah, very, very apt. I mean, if you're lying down and that is happening, so many things. It can be ear dysfunction. All right. It can just be your balancing system in your ear. So many things. So please can see your doctor. Thank you, Dr. Donye. I think there's okay, I think that's okay. How often will you hold similar sessions? All right, fine. So I mean, this program has been for a year, more than a year. We had our first year anniversary, January, the January 19th edition. That was the Your Art Needs You Part One. That was the session that we used to mark 1 year of an hour with a cardiologist. But this year, so we used to have it once in 2 weeks. It's a bi-monthly program. Well, it used to be a bi-monthly program once in 2 weeks. But this year, it appears as if we're getting busier, so many demands here and there. So apologies, and that's one of the announcements or the information we want to bring to our notice. We're moving it from once in 2 weeks to once in a month. Please, apologies for that. Um, we're sorry. We're we're going to be reducing the frequency of our meeting. We're becoming. You'll notice that we should have had this particular session 2 weeks ago. It was postponed. Last week it was postponed as well. It was because of very tight schedules, and we don't want to keep saying, "Oh, sorry, apologies. We are going to the meeting will not hold this week. It's going to be next week." I mean, I don't think we should be doing that. So please pardon us. We are moving it to once a week, but will give us ample notification, all right, like a week, all right, or at least if it's going to hold on Sunday, would make us to know on the Monday before that Sunday, all right, so that everybody can be on the same page, and we will spread it very, very widely. So that is one thing we will make sure we do. So the next edition will be in March. All right, likely second or third week of March. Will let us know, a week before then. All right, but it will still be as rich as possible and as rich as it has always been. That's one. Two, we will also, with time this year, we'll also be having other um, professionals, okay, other specialists that are managing other ailments that may impact on the heart. So we're going to have somebody who is an expert in the management of diabetes, and is going to come talk to us. She's going to come talk to us on diabetes and the heart. All right, we're going to have a pediatric cardiologist who will address us on issues of congenital heart defect and heart diseases of children. All right, so all in the heart and all of that, we're going to have someone who will come over to talk to us about it. We're going to have someone who will help to deal with challenges of the elderly, old age, and heart health and things like that. We're going to make it much more richer. All right, but for now, please, it's going to be once in a month. All right, thank you so much for everything. Now, we will not call you for any reason, because we've had instances where people will just send a link and say, "Oh, hold our meetings sporadically." No, there's always a time, and we always bring out flyers. So please, if somebody calls you and says, "Oh, do you know that are you aware of the fact that there's an hour with a cardiologist meeting tomorrow or this night?" Just click that link or call that link. It's a scam. It's a scam. The person is a scammer. Please just block that person or report to us, report to the admin, report to that number. Just send that number a chat. All right. The number on the chat box. Just send a text message or WhatsApp message, and we will quickly deal with it. We will not ask you for anything. We will not call you and tell you there's a meeting, so. No, we won't do that. And whoever does that is not from us. So please just be aware of that. Want to say thank you to everybody. I hope there's no other person in the end. All right, no other person. So I want to believe that this um, um, session has been a good one as well. Thank you for joining us. Thank you for listening. Thank you for the patience. Thank you for the engagement. The recording has stopped. And